So we're going to talk about thyroid, right? The thyroid, you know, with Google, and most people know so much about everything now, it's kind of great, but we're going to go through this pretty quickly, okay? Thyroid's a gland shaped like a shield right here in the front of your neck, all right? Now, every single cell in your body, all right, has receptors for thyroid hormone, okay? So the thyroid is a very, very, very important gland in your body, okay, for physiology, right? Now, your thyroid supports everything. Like I said, every cell in your body has receptors for thyroid hormone, right? So your thyroid supports bone metabolism, it supports your immune system, it supports your brain and nervous system, it supports your endocrine system, your GI function, your liver and gallbladder, growth and sex hormones, fat burning, insulin and glucose metabolism, healthy cholesterol levels, proper stomach acid. So this is why somebody with a thyroid disorder, they have a vast array of symptoms, and if you just think about symptoms you get from brain and nervous system, when you get brain fog or you get headaches, endocrine, okay, maybe some infertility issues, GI, maybe you have gas or bloating or ill or bowel type symptoms, all right, fat burning, maybe you can't lose weight even with a low calorie diet and exercise, all right, insulin and glucose, maybe you're hypoglycemic or you're pre-diabetic. Healthy cholesterol levels. Maybe you're female and there's no reason why your cholesterol should be climbing, but it is. So now you have to go on a statin drug along with your Synthroid to help manage that. Okay? So the thyroid is imperative. It's so important for every single function in your body. Okay? And a lot of times the thyroid gland isn't the problem. Okay? Sometimes you have to look at other systems or other of these support systems, and they may be the problem, possibly affecting the thyroid gland through feedback loops, okay? So when the thyroid gland gets affected, or if any of those support systems get affected, your body breaks down and you get symptoms. Like I mentioned, every cell in your body has thyroid receptors, okay? And this is over and over in the literature. So here's a snippet from a physiology book. All right, these receptors attach to thyroid hormones and bring them into the cell to perform a function. So the key to thyroid health, this is the key, all right? You have to get just enough of thyroid hormone into the cells. Not too little, not too much, just enough. And we're going to talk about why that is, okay? So if you don't get enough into the cells, you get symptoms of hypothyroidism, okay, or low thyroid function. And these are the symptoms that we see: fatigue, weight gain, even with a low-calorie diet and exercise, okay, depression, constipation, all right? You're sensitive to cold weather, especially coming up into the cold season, all right? Muscle cramps, even while you're resting. Some more symptoms: poor circulation, all right? Itchy, dry skin, all right? Stomach pain, gas, bloating, all right? Dry, brittle hair, your hair falls out easily, all right? This is males and females, and that's a pretty textbook symptom that is seen in patients with thyroid, okay? Or swelling throughout your body, okay? And then we get those neurological misfirings that can lead to the brain fog issues, okay? So your body breaks down, okay? And we would say that you're out of order. You have multiple symptoms, your body's not functioning properly. So now when too much hormone gets into the cells, you have symptoms of hyperthyroidism or Graves' disease. Okay? This is where you get heart palpitations, you get trembling, your pulse rate skyrockets, you feel nervous and emotional all the time, insomnia, night sweats, you have difficulty gaining weight, okay, if you're getting too much hormone into the cells. Right? Now, with Hashimoto's, which we're going to talk here in a little bit, all right, you actually can have symptoms of both hypo and hyperthyroidism. So that is one of the things that we look at clinically through history is like, are you having symptoms of both? Okay, and if you are, well, that's a red flag that maybe we need to run a test to find out if you have Hashimoto's, which is an autoimmune disease of the thyroid gland. Okay. Now, the symptoms happen because with Hashimoto's, your TSH level can fluctuate so much day to day, week to week, month to month, where it's really high, really low, and symptoms cascade back and forth between hypo and hyper symptoms. Okay, so to understand thyroid problems, we understand the thyroid gland and how it affects your body, okay? How it affects and how it interacts with the rest of your body, right? So the four main systems that we're probably going to touch base tonight are the endocrine system, the immune system, the nervous system, as well as the gut, okay? These are the four main systems that we see in our office on a daily basis that either are the cause of the thyroid breaking down or the thyroid breaking down is causing symptomatology in those systems, all right? So the immune system, the gut, the brain, as well as the endocrine system.